Hi, I'm Liz Glass. I'm a dietitian with Gaylord Specialty Healthcare, and I'm here today to talk to you about the DASH diet. So what is the DASH diet? The DASH diet means Dietary Approaches to Stop Hypertension. This focuses on foods that are lower in saturated fats and trans fats, richer in potassium, calcium, magnesium, fiber, and protein, and lower in sodium. You will have a limited salt intake where you aim for about 2,300 milligrams of sodium daily, but you can go as low as 1,500 milligrams a day if you desire to lower your blood pressure further. So why the DASH diet? The DASH diet helps to reduce the risk of stroke. It does this by helping to lower blood pressure, which is a precursor for strokes. We also want to reduce our amount of salt intake because salt puts pressure on the body. Excess salt can cause fluid retention, which puts more pressure on the heart and kidneys as these two organs work together to help manage fluids in the body. When they are under pressure, they have to work harder. Increasing calcium intake is also helpful, as calcium helps with bone health and to reduce the risk of stroke. Magnesium and potassium are good for overall cardiovascular health and help with reducing cholesterol levels. Foods encouraged on the DASH diet include vegetables, fruits, and whole grains. Bonus points if you eat your fruits and veggies raw, as those have a higher fiber content, fat-free or low-fat dairy products, and lean sources of protein such as fish, poultry, beans, and nuts. Foods to limit on the DASH diet include foods that are high in saturated fats, such as fatty meats, full-fat dairy, oils such as coconut, palm, and palm kernel oils. Think fats that are solid at room temperature. We also want to limit sugar. That includes sweetened beverages, candy, desserts. Yes, that means watching your candy intake and how much sugar you're adding to the coffee in the morning. It all adds up. A high salt content we also want to limit. That can be a little sneaky, and that can be found in foods such as frozen dinners, canned soups and vegetables, condiments, and foods packed in brine or with words that say pickled. We also want to avoid using that salt shaker, meaning adding extra salt to our foods, because 1 teaspoon of salt has 2,300 milligrams of sodium in it, which is typically what we want our limit to be for the whole entire day. A few tips that I like to give my patients are to rinse canned food items. You can always try and purchase lower sodium canned items, but rinsing them reduces any of the extra salt content before using them. Always check the nutrition label. If you look per serving size, less than 140 milligrams of sodium per serving is considered low in salt. Watch your condiments. This means to ask for the sauce on the side when you go out to the restaurants, or to make sure you're checking again, the nutrition label is going to be your friend, and look for those serving sizes and see how much sodium is in each amount of the condiment that you're adding, because that can add up really quickly. Also use salt-free seasonings. You can pack on a ton of flavor that way without additional salt. Cut back on the salt shaker, as we discussed before, and try and cook at home as much as possible. When you're cooking at home using fresh ingredients, you control what's in the food and not somebody else. For more information, the resource that I used for this presentation that I think would be beneficial for you at home that are viewing this is the National Institute of Health. Feel free to go and visit there, and they have plenty of great recipes and tips for following the DASH diet as well. Thank you so much for watching our video on the DASH diet. Please feel free to check out our other videos in the stroke education series from Gaylord.